Doctor, I've already had tests done. I've taken all kinds of medicine for vertigo, but I still have this weird dizziness that no one can really explain or treat properly. I hear this sentence at least 5 times a week in my office. And every time I hear it, I immediately think, hey, this could be PPPD, persistent postural-perceptual dizziness. If you, who are here with me right now, have been feeling this way for months or even years, like your head is empty, your head feels weird, you have constant imbalance, a sense of insecurity when walking or doing things, your symptoms get worse in supermarkets, malls, colorful places, and every doctor says your tests are normal, you might have finally found your answer. In the next 10 minutes, I'm going to show you exactly how I treat this condition, which most doctors, honestly, don't even know about. DR. Saulo Nader, a neurologist, also known as DR, dizziness. Every day I see frustrated people who have already been to 5, 10, 15, even 50 different doctors. The record was 55. People who feel misunderstood, who have heard it must be anxiety so many times that they started to doubt themselves. And if you found this video because you relate to this description, leave a comment telling me how long you've been dealing with these symptoms. You don't need to go into detail, okay? Just write down the amount of time, 6 months, 2 years, 5 years. This helps me better understand the profile of my viewers, and most importantly, it will show you that you're not alone on this journey. And I need you to know that there is a medical explanation for what you're feeling. There is a treatment that works. I like to break down the treatment for PPPD into 4 approaches. The first approach is medication. The first thing I do is a clinical evaluation. Remember, there are no tests to confirm PPPD. The diagnosis is clinical. And here's the first surprise for many patients. I'm not going to prescribe Labyrin, which is beta-histine, beta-circ, betadine, flunarizine, which is Vertix, Vertazine, Flunarim, or any other medication for labyrinthitis. PPPD is a problem with brain chemistry, not with the inner ear. That's why I have to use medications that recalibrate the brain's serotonin. And what are these medications? Antidepressants. Not because you're depressed, but because these medications correct the neurotransmitter imbalance that's causing your dizziness. Not just any antidepressant, and not just any dose. There are specific antidepressants for this purpose, in specific doses, and that will vary. The choice depends on the person. Each person will have a better profile for using a certain antidepressant over another. And to choose the right medications for each patient, I take into account factors like age, medications they've already used, whether they've tried other antidepressants before, the intensity of the symptoms, among many other things. Every brain responds differently. What works for one person might not work for another. And I always tell my patients, okay, there's no way around it. It's going to take about 3 or 4 weeks to start working, just to start. Sometimes I need to switch the medication, and sometimes even combine medications. So yeah, it's frustrating, I know, but it's an expected and normal part of the process until we reach that much desired improvement. The second approach involves vestibular rehabilitation, but pay attention, I don't just send any patient to do just any exercise. My criteria for recommending vestibular rehabilitation are as follows. Every PPPD patient will benefit from early vestibular rehabilitation that starts together with medication treatment. This is important, okay? So if there's no medication treatment, vestibular rehabilitation won't have any results. And secondly, the vestibular rehabilitation professional, they need to have expertise and knowledge. They have to know what PPPD is and have already treated other patients. Otherwise, things probably won't go smoothly. The exercises are different from those for other conditions. So, these vestibular rehabilitation exercises for PPPD focus on visual habituation, progressive balance, and gradual exposure to triggers like supermarkets, crowds, among other things. So, you need the expertise of a professional. The third approach focuses on the emotional side. And before you think, oh, here comes another doctor saying it's all in your head. That's not it, okay? It has nothing to do with that. PPPD is a neurological disorder, that's a fact. But there is a strong link with the emotional side. In other words, PPPD really messes with our mind. Constant dizziness causes anxiety, distress, fear, and apprehension. You start avoiding places, you develop fears. And that fear gets worse. The dizziness becomes a vicious cycle. And does everyone with PPPD develop this? No, not everyone. But when I see that the patient has developed a fear of driving, of leaving the house, of living their personal life, of making plans, when anxiety is clearly fueling the symptoms, then yes, I recommend doing cognitive behavioral therapy with a psychologist who understands PPPD. It's not enough to do just any therapy. It has to be cognitive behavioral therapy, the one that's in the books and articles, the one that's proven to work, and it needs to be a therapist who has experience in this area. And speaking of that, many times, just by clearly explaining the illness, showing the person what they have, the name, the treatment, this alone already greatly reduces the patient's anxiety. That's why I'm going to ask you now, okay? How long have you had these symptoms? Have you already developed secondary anxiety? Do you have any other conditions as well? Even family support makes a difference. That's why I prefer to take things slowly. I explain each step, letting the patient understand their own recovery process. The fourth approach is a device called transcranial magnetic stimulation, or TMS. It's a device that was designed and developed for psychiatric use, especially for depression. But we already have studies in the literature proving its effectiveness in the context of PPPD as a treatment enhancer. So today, the complete treatment for PPPD would also involve, in an ideal world, in the best case scenario, the use of transcranial magnetic stimulation as well, allowing for a faster, more agile, and more comprehensive treatment, with a higher statistical chance of the person reaching a perfect score of 10. And here, folks, I'm going to take a moment to explain to you how it works. It's a combination, okay? So, when we talk about treating PPPD, we're dealing with a chronic illness, a disease that's been around for a long time, throwing you off balance, destabilizing you. It affects you, your emotions, takes away your lifestyle, making you a hostage to it. We have to use every tool that the literature provides. We need to have a complete treatment, because the more complete it is, the greater the chance of success, and the faster that success comes too. So, is just the medication enough? Look, I'm not going to lie. Just the medication usually isn't enough. Why? Medication is one part of the treatment. Maybe the most important part, I agree, but it's just one part. The full treatment needs to be carried out. So, nowadays, it's mandatory that all patients with PPPD, in addition to medication, also have good vestibular rehabilitation focused on PPPD and solid psychological support from a behavioral therapist. That's what the literature recommends for all patients, and it's what I try to provide for all of mine. because I'm a big supporter of multidisciplinary treatment so that one thing complements the other and we can achieve the best possible improvement. And in an ideal world, transcranial magnetic stimulation could also be added as an extra, a bonus, something to boost the process, giving us much more speed and a much better chance of reaching a perfect score. Will I reach a perfect score, doctor? I aim for a perfect score. I give it my all so that we can help the person, you who has TPPP, get back to living a completely normal life. Sometimes we might not reach a perfect 10, okay? But we'll get very close to it. So the closer we get to a perfect 10, the better. And this is where the strategy of a complete treatment comes in again. The more complete the treatment, the greater the chance that a perfect 10 becomes reality. So do you get it? Medication, folks, is just one part of the treatment. The treatment needs to be complete. And the goal is always to make sure that dizziness stops controlling your life, so you can get back to working, going out, traveling, keeping your commitments, and living without fear again. Not just surviving with dizziness, but truly living again without dizziness. And that's also why regular checkups are necessary, especially in the first few months, because you need to make progressive adjustments to the medication, tweak the strategy, sometimes add other medications to the treatment, and make fine adjustments to the dosage. Medical visits need to be scheduled in sequence, and they should be more frequent during the initial appointments. In general, we use the medication for about a year to a year and a half. After a year and a half of stability, if everything is great, we are allowed, if the patient wishes, to try a gradual tapering and discontinuation of the medication. Is there a right or wrong way? Do I have to stop taking it or not? It's an individualized decision between the doctor and the patient after a year or a year and a half of stability. Some people prefer to try stopping the medication, while others feel safer continuing to take it. And these are medications that have already been validated for long-term use and safety. So again, it's an individualized choice. And if you've made it this far and finally feel understood, know that your journey of suffering may be coming to an end. Because TPPP, look, it has a name. And what a name, right? What a strange name. There's an explanation and there's treatment. In the comments, share how long you've been living with these symptoms. Your story might inspire someone not to give up. And remember, okay, you're not crazy. It's not just being dramatic. It's not just anxiety. It's a real neurological condition that needs proper treatment. Don't stop searching until you find a professional who truly understands you. And to get all the content, subscribe to the channel. Don't be silly, come on. See you in the next video.